The lecture is entitled Medical Responsibility or Medical Malpractice. So what is the definition of malpractice? It is failure of the medical professional to follow accepted standard of practice resulting in harm or death of the patient. This means we have more than one element. It is failure of you which will result in harm. Suppose you failed in something and there is no harm occurred to that patient. So in this point, there is no malpractice. There is 4 elements of tort of negligence or malpractice. This means there must be 4 points which occurs connected to each other. At this moment, the patient can sue you as a doctor with malpractice. So what is this element? The first is what we call a duty of care. You are in duty to treat that patient. Then you are breaching that duty. You neglect. You are deviated from accepted medical standard of care. Either by omission you are neglecting to do something to the patient, or by commission you are doing something wrong to that patient. This will result in patient injury, okay? And in this moment, the patient can sue you due to breach of the standard of care, okay? These 3 points should have a connection between your breaching of care and the injury of that patient. In other words, the formula of liability is you are in duty, there is what we call derelict or neglect, there is a direct cause between your breaching of duty or your negligence of duty, and there is harm to that patient, and there is connection between these parts. So your failures could be either in diagnosis of a case, or during the investigation, or during the treatment, or failure to follow up. Some of us doesn't consider the follow-up to be a step in malpractice. Mistaking the diagnosis could be either wrong diagnosis or delayed diagnosis, and you avoid this situation by taking a careful history from the patient, examine your patient thoroughly, asking for all investigations that help you in diagnosis, either laboratory or radiologically. At that moment, if you're still in doubt about your diagnosis, ask for consultation, one of your professor or seniors. You can miss or delay a diagnosis due to your ignorance by the basic scientific knowledge. The mistake in investigation could occur if you don't ask the proper investigation. You are free to choose the methods of treatment in your patient as long as it depends upon the scientific basis. If you as a physician doesn't ask for a proper investigation, it is a mistake. If you don't interpret properly the results, it is a mistake in the investigation. You can commit a mistake in treatment. If you are prescribing a wrong medication or inaccurate dose, or you are prescribing one of the dangerous drug or non-approved drug. Whenever you are writing a drug be sure it is registered in your country. Okay, if it is not registered in your country, this can be a responsibility to write a treatment which is not registered in your country. But be sure, if there is no alternative, that it is approved by one of the common big organizations like FDA's. Okay, if it is approved for that disease to be taken as a treatment of that disease, don't use a drug which is registered in your country in treatment of another disease. Let us give an example. If uh, a medication has been registered and approved by FDA and it is used in treatment of cancer colon, and it depends upon prevention of the vascularization occurs in the malignant tumor, or it include the vessels that nourish this cancer or this malignancy. Okay, don't take the same idea and treat another disease, like the new vascularizations occurs in diabetic patient or in some patients. Some of them have vascularization in the retina. Okay, don't take the same drug and inject them in their eyes and say it has a scientific basis. Yes, it has a scientific basis, but it is not registered and not approved. Okay, this will be considered as a mistake in treatment. And if your patient's exposed to one of the side effects, you will be sued as making a malpractice due to wrong treatment. What about failing in follow-up? You have making a proper diagnosis, you're asking for a proper investigation, and you do good treatment for your patient, but you don't follow him up. Okay, you don't monitor that patient after that. Okay, this can lead in certain situations, like in case of surgery, to a post-operative complication. The patient can be exposed to what we call anaphylactic shock. Okay, and this failure of the follow-up can be considered as a condition of the malpractice. Here we have examples of errors that occurs in malpractice, like general errors, for example, failure to obtain a proper informed consent from the patient, failure to order proper investigation or lack of proper interpretation, inadequate clinical records, working under effect of drugs or alcohol. If you are tired, if you are taking a medication which will alter your mental status, please don't treat your patient. Some situation, like in emergency cases, as if you are refusing to attend a patient which is critically ill, if you are failed to diagnose something critical like myocardial infarction or intracranial hemorrhage or some serious condition, if you are failed to refer the patient to a hospital or a specialist for an opinion or second opinion or consultation. In case of anesthesia, you may give your patient a wrong dose of anesthetic drug. Your patient may be exposed to hypoxia due to improper oxygenation, and this will lead to brain damage. Another example of malpractice is neurological damage, whenever they are injecting the patient in his spinal cord with epidural drugs. Let us say about the surgical malpractice. This occurs due to either technical faults or objective mistakes. Technical fault, like deviation from the scientific basic rules, and this is the outcome in as regard the malpractice, it may be minor malpractice case or major malpractice case. But if you forgot something like scissors or a piece of cotton or a piece of gauze, okay, this will considered at that time as a major mistake. Another error may be seen in surgery, like operating on wrong patients. I remember an accident occurs more than 30 years ago. We were in minor operation theater, and usually we know that number one will have an abscess, number two will have hemorrhoidectomy, number three will have fissure treatment, and so on. And whenever the patients come on, we are doing the operation. We know number one is this, and number two, and one of the patients was so afraid, okay, and say to the next one, go before me, I'm so afraid. You can see now we can have a wrong patient for a wrong operation, and we can make a wrong side of patient. Sometimes occurs all over the world. It's not related to one country. There may be a bad sterilization of the instrumentation. In orthopedic, we can see a misfracture, especially whenever it is in skull, femoral neck, cervical spine. Okay, there may be tissue or nerve damage secondary to tight plaster. As we consider the patient and its health, and we are working for his benefit, we should protect our colleagues, our doctors. How we could protect our doctors and preventing the process of suing or malpractice accusation. First, you should take a proper voluntary informed consent. Okay? This means you are giving the patients all the information about the injury, the treatment options, the complication. If you do a surgery, what is the surgery and its complication? What is the type of anesthesia and its complication? Who is going to do this operation? Okay, all that detail should be given to the patient and should be written in a paper, and the patient and the witness should sign this. Okay, and the witness should be from his side, from one of relative or neighbor or something like that. Don't take one of your colleagues or one of the medical staff or nurses to sign as a witness for that patient or any patient. Okay, secondly, you should provide the best medical care. All the medical care you are providing to your patient should be universally accepted. It is standardized. Okay, don't compromise on the standards of operating theater or infection control. Ensure complete and clear documentation. This means the patient's condition, its diagnosis sheets, its consent, communications, investigations, whatever. This document should be clear, complete, by book, as standardized guidelines. If you are in doubt, ask for consultation of one of your professors or seniors. Do not hesitate to order any investigation. However, it is repeated. It is essential to avoid wrong diagnosis. Always choose qualified assistants if it is possible. You are choosing your assistant, choose the qualified one. Double check for important information like the side of the patient, like the name of the patient, like the laboratory test if you are doubting something. Make sure that the patients clearly understand about their medication, how they take it, when they take it, before meal, after meal, at the morning, at the night, whatever. And be sure he will not misusing these drugs. What we usually have a complication with is communication. You don't have time to your patients. Please spend a proper time with your patient, take a proper history, answer his question, okay? Ask about his allergies, other medications, familial history, whatever. Okay, and give him enough information about his treatment. And repeatedly, always adopt standard, universally accepted protocol during management of the condition while referring to procedures in a standard textbook. Due attention should be given to evidence-based treatment. How about the law and the malpractice? I read this. This is the law article of in Egypt. Uh, I just translated, and if you are as a doctor making a death and you cause death of someone due to negligence, due to not following standardized methods, or you do it due to you are not respecting laws or regulations, you will have imprisonment for a period not less than 6 months, and with a fine not more than £200. And this is the initial law. This is the basic article. And if you are accused with malpractice, there will be another compensation will be considered by the court. If you are doing a major malpractice deviation, okay, so the sentence or the imprisonment will be not less than 1 year and not more than 5 years, with a fine not or ranging between 100 or 500 pounds. This is in addition to the compensation. If you are deviated from the accepted rules, if you are taking some of the medications or alcohol or something like this. Another article considered the compensation of the patient if you have been accused with malpractice. And there is another article said that from the day as a patient you know that you have been malpracticed, you will given 3 years from the day of your knowledge to make a case against the doctor. There will be, of course, a compensation to the patient due to the harm, like pain, like infirmity, like paying a lot of money to improve the his condition, or to repair the mistake. And there will be something like pain or stress. This will be all of this will be considered in compensation. Here we have a case studies which is solved, and some other question as a practice for you. Thank you.